close attention, Tucker Barnes. Every year, more Americans fight the battle of the bald, trying to hold on to their hair even as it recedes further and further from their brows. University of Pennsylvania researchers may have figured out why some men lose their hair. They say a decrease in the size of hair follicles may trigger a domino effect, which then results in male pattern baldness. And joining us this morning is Dr. Monty Harris. He's a board-certified facial plastic surgeon and also an expert in treating baldness in men and women.
Good morning.
Good morning. Thanks for being here. Hey, let's talk about this study first of all. What do you make of it?
I mean, it's really exciting because when we look at hair loss, there are a lot of questions both on the side of how hair grows and how we lose it. And the study is pretty important because it says that those cells that we think are important, the stem cells, are actually still there in hair that's bald. So we have that capacity potentially of reversing hair loss, and that's really exciting. It's, so now that we can direct more research towards, stem cell activation and then treatments that may be more therapeutic with regards to reversing that process.
I was teasing Tucker and saying you need to pay close attention to this. We tease him because he's got a head full of hair, but it seems like some men are maybe more prone to losing their hair than others, and some women too.
Right.
Is it heredity also?
Right. When we look at this idea of hair loss, it ends up being sort of an equal opportunity, a problem, and that it's both men and women. And I think a lot of the attention has been directed primarily at the issue with men.
Right.
But also with women, there's sort of a double whammy with both sort of genes and hormones come into play, but also traumatic grooming practices. So, this idea of hair loss becomes something that we need to really look at in a more of a customized or individualized approach, going beyond sort of cookie cutter approaches that we see sometimes on TV and in the media.
We see some of the ads, on television, and for a lot of men, I think it's certainly kind of an ego thing, and vanity maybe, for some.
Right.
But in the old days, it seemed like the only option was the old plugs.
Right.
Or perhaps maybe even like the old
comb over
or some sort of toupee or something like that. Are those days gone?
I mean, I can confidently say the days of the plugs are gone. I mean, we really.
And when we talk about plugs, explain what we're talking about.
There were this idea of having sort of large areas of circular tufts of hair that were placed in areas that were balding or thinning. So, hair restoration or hair rehabilitation has really become more innovative because we can customize it.
Okay.
I mean, we can look at age, we can look at gender, we can look at ethnicity, textures of the hair, and also grooming practices to really come up with what I would consider to be a customized approach. So
let's talk about it. Let's talk about what the options are for a man or a woman who may be losing their hair today.
Right. So when I see, there's a patient there that underwent what I consider to be a scarless transplantation.
And what is this?
This is a young lady that had hair loss that was pretty focal, and we were able to take individual follicles from the back of her scalp and transplant them into that area where the loss was without making an incision. So I think that one of the newer approaches is that we don't necessarily have to make an incision at the back of the scalp. There are new techniques where through automated tools, pulling individual hairs. So that really changes the game for people that are concerned with scarring.
Hey, Dr. Harris, that sounds like a really time-intensive and expensive procedure.
Well, it's a combination in that it is time-consuming because it takes a fair amount of time to pull individual hairs and to transplant them. But, imagine being able to really restore, your loss with your own naturally growing hair. And price ranges. I mean, price ranges dependent upon how many grafts and the extent of the loss. So, one of the wonderful things about hair restoration is that there are all these different points of entry, where we can have a positive response.
Before we let you go, real quickly, scalp stimulation to stimulate the follicles there, is that a laser procedure? Is that something that works too?
Yeah, and that speaks to the University of Pennsylvania study, and that in those areas that were bald, there was really still microscopic hair there. And the thought was that if you could stimulate those cells that were a little sleepy to become more active, then you could grow back the hair. So there are a variety of different things that we're looking at now to do that. One of the sort of hot topics is this idea of using light therapy or low-level light therapy to reactivate the hair.
This sort of helmet.
Yeah, so
goes
there's
to.
a unit, you know,
Right.
on here
Right.
that we have now in the
Okay.
office that's a home unit that
Right.
you're able to sort of, you know, use this on an ongoing basis to sort of reactivate
Great.
those sleepy spells.
The bottom line is there are a lot of options out there, and you and your office can do just whatever anybody is interested in, and they can discuss all of that with you.
Yeah. No,
Thank you much.
It's all good. Thank you. Thank you
Appreciate
very much.
you being here. Allie, back to you.
All right, just about 8:39.